This computer. Okay, good. Welcome to Life, Love, Insight, Fertility Experiences. I am here in person today with Dr. Lowell Ku at the ASRM conference. It's so exciting because he is like one of my favorite doctors. And so this is great. And we're going to talk about male infertility. So we've talked about this in the past, but I thought it would be so fabulous to just give a male infertility 101, because
Perfect.
I don't think there's nobody better to do this than you.
Thank you. Thank you.
Do you want to tell a little bit about yourself?
Yeah.
And then I have to say one thing. He was awarded and he's a board member at ASRM. I am blown away by him.
Well, thank you, Lori. Thank you so much for inviting me onto your podcast. This is
Please.
such a treat and an amazing. It's amazing to be able to do this in person with you. So it's awesome. I know usually we're far apart, so this is great. So thank you so much, and it's an honor to be able to be here. And so I'm Lowell Ku, and I'm a fertility specialist in Dallas, Texas, with a practice called Dallas IVF. And I've been there for 16 years and been practicing, ever since I graduated fellowship. So lots of fun.
Fabulous.
Yeah, it's been great. So I'm excited to talk about male fertility, or male infertility rather, today. I always say it does take two to tango, right? So for the male, it's very important to be able to test to make sure that the male it doesn't have a factor in a role in the infertility.
Right. Right. It is. And it's funny because men don't really like to think that they're infertile or there's a problem with it.
Yeah.
And we really want to try and change that narrative that it's a diagnosis. And is it up to 50%? It's like 50-50 between men and women.
Exactly right.
For infertility.
Right.
So, okay, couple walks into the office.
Yes.
Right. And they want to have a baby, but they've been trying and they can't. So they come to you.
Yeah.
And they find out that they both get tested and it seems like the woman is fine, but the male is not. And so what happens? What kind of test does he go for?
Right. So I do agree that we should test the male from the very beginning as part of the initial workup. And so the test that we mainly run is one main one, and that's semen analysis. And that's just check to make sure that there is enough sperm. But it's a very special semen analysis. We're looking for a lot of different parameters, such as the count. In other words, how much sperm does the guy make? The motility, which is what percentage of sperm are actually swimming, and what percentage of those sperm swimming are they swimming forward? The third thing
That's really interesting.
it's just called progressive motility. We got to see, because sometimes sperm are swimming in circles or they're sort of twitching in place. We do count that as motility because they're moving, but they may not be progressing forward. So that's very important to know. And then the third part is what we call the morphology. So that's called the shape of the sperm. So the shape of the sperm is very important because only normal shaped sperm are able to penetrate the egg and fertilize. So the male testicle, I always tell my patients, the male testicle is extremely inefficient at creating normal shaped sperm. It's very bad.
Wow.
It's so much of that you only need 4% of the sperm to be normal shaped to be considered a fertile male.
That is unbelievable. And women is such the opposite.
Right.
That is wild.
Only 4%. So that means 96% of the sperm can be completely abnormal, still can have a baby. It tells you how inefficient the male testicle is. And so what we're looking at is, how does the testicle manufacture the sperm? It has to be one head on a one tail, and it has to be like that millions and millions of times. But sometimes there's small head, big head, missing head, two heads, or one tail, or sorry, two tails, broken tail, missing tail, or the neck is broken. It is very amazing how crazy the testicles make the sperm. So only at least 4% of the sperm must be normal shape. So that's really important. And so we run the semen analysis, and then I show it to the husband. And if there is an issue, first I always say it's no one's fault. We're not pointing fingers, but sometimes the sperm is not working for us. So let's start with the count. That's the sort of the three basic things we look at when count. Obviously, it's either you have enough, not enough, or none at all, right? So we have to kind of then break down why is there not enough sperm, or why is there no sperm? And we look at it in three different categories. One is pre-testicular, like things that happen before the testicle. Then there's testicular. And then the third component is post-testicular. So after the sperm is produced and it's starting to come out, why is it being blocked? Why is it not coming out?
Wow.
So pre-testicular are things that guys can do that can affect the sperm production. So for example, testosterone usage. A lot of guys take testosterone. I get it. As they age, they don't feel as strong and as healthy. And so they take testosterone when their testosterone levels are low. And what happens is testosterone used to be considered like a male birth control. it actually stops production of sperm in the testicles completely.
Wow.
And you get zero sperm. And so it's very, very interesting. So some guys don't realize this. And some guys who are using testosterone to bulk up, they want to be very virile appearing. But sadly, the controversy is that they're very sterile.
Mhm.
So that's an example of pre-testicular. Another example.
What about like when people are drinking alcohol
Oh,
or
yes.
smoking pot or
Yes.
things people do socially or just in their own home on a regular basis?
So those would be pre-testicular as well. Marijuana, exactly, it sort of mimics estrogen, so it causes a decrease in production of sperm. So we always say we don't recommend that. And then alcohol, we say it doesn't directly affect the sperm count or quality, but sometimes it can impair a guy's ability to perform. And also, alcohol is a diuretic, so it really dries a guy out. So they'll need to drink lots of water after they drink alcohol to maintain a good volume so that when they do produce sperm, there's enough volume there to bring out a good number of sperm.
Oh, okay, great. That's
Yeah.
important.
And then the last two is just testicular, right? So something happens with the testicles, it fails. So it's testicular failure, where nothing is turning on the sperm factories. And then there's post-testicular, which is blockage, like a vasectomy. Guys have had vasectomies, they'll try to get them reversed, but then if they can't hook it up properly, sometimes sperm still can't pass through. So those are some post-testicular issues. But those are the three things to account. When it comes to motility, smoking tobacco can affect that. So we do recommend no smoking tobacco. I know it's hard. And then the morphology, there's only one known medical reason that can cause the shape of the sperm to be like abnormal, and that is heat exposure to the testicles. So guys who literally are sitting in like hot tubs and bathtubs and boiling their testicles, it causes the sperm factories not to work well.
It makes sense.
Yeah.
It's really logical when you think about it.
So we do recommend avoiding all those things. So what can a guy do? Let's say, like you said, the couple's now had their tests, and now they're meeting with me for post-test follow-up. And then we see everything in the female is great, but the sperm has issues. So if it's a count issue, it depends. Are they taking testosterone? We can tell them to stop testosterone. And a lot of times I get asked, how long do I need to stop these medicines before I can see an improvement? The answer is around 3 months. It might take 3 months. So earlier you can stop it, the better. Or if they're smoking marijuana, we say stop that as well. Perhaps if there is a low morphology issue, which is a very common issue, we say, okay, well, are you sitting in hot tubs? Are you sitting in bathtubs? Are you, usually guys are like, no, I don't do that. So then there's some lifestyle changes that you might be able to do to affect a change in the shape of the sperm. And those are things like make sure no laptop on your lap. You may want to consider changing from briefs to boxers to allow the testicles to be a little bit cooler. And here's the interesting fact. Did you know that testicles need to be only 1 to 2 degrees cooler than the rest of the body? And that's why they hang outside of the male body.
That's fascinating.
Yeah.
And because if you think about it, though, there's so many layers that go on
Right.
usually, right?
Right.
So that makes it, it's interesting.
Yeah.
It really is.
It's an amazing fact. And so ovaries are not
I've heard that fact before.
Yeah, isn't that cool?
Yeah, it's really, yeah.
So ovaries are not temperature sensitive, so they can be inside of the female body, but testicles need to be just about 1 to 2 degrees cooler. So guys ask, they say, okay, well, what if I sit on a cold ice? Like, no, it's only needs to be 1 to 2 degrees, nothing too extreme, right? So it's just a little bit cooler for the factories to work well. And so it's very interesting. So you can imagine
carrying your phone in your pocket.
Yeah.
A lot of wives that will say, why are you carrying your phone in the
Yeah,
pocket?
yeah.
You know, it shouldn't be there.
Very good question. I get that a lot as well. And they actually did some small studies that showed that the cell phone in the pocket doesn't quite affect or doesn't cause enough heat to affect the testicles. So
But it's a heat issue.
It's a heat issue, yeah.
Oh,
Rather than like a radiation issue. Like that,
right.
yeah.
It's not really, okay, that's good to know.
Yeah. So those are some of the things for male fertility. You know, some of the easiest things to find because the semen analysis is straightforward. Sometimes some of the hardest things to fix.
Yeah. It sounds like it. It sounds like that would be the hardest thing to fix. Yeah. So are there any other things people should know when they're going into the doctor's office about the tests or any treatments?
Yeah. So let's talk about semen analysis. So we do say before you come and collect sperm, you have to wait 2 to 5 days to build up sperm. So no ejaculation for 2 to 5 days. We also say make sure you have an appointment. That's the other thing. I'm sure a lot of offices require appointments before they come in because I've had a lot of husbands come in unannounced and we have to turn them away. But yeah, so those are the two things. And then just really remaining hydrated and living a healthy lifestyle, you know, multivitamin every day, healthy living, healthy exercise. That's really all you need.
That's it.
Yeah.
Wow. Okay, that sounds good. And then if somebody has one of these things, they can still conceive. They can still have a family.
Absolutely. It's
Yeah.
definitely not game over. I tell patients we'll find a way to still get you pregnant. And for example, the morphology issue, which is so common, I tell them this is a factor, but it's a minor factor.
Mhm.
Plenty of patients still conceive naturally, even with a low morphology.
Yeah.
Yeah.
Right. And they could do that through, do they need to have IVF to do that or IUI to do that?
Luckily with IUI, we can actually overcome some of the morphology issues because the
Mhm.
thought is if we can introduce more normal shaped sperm into the system, it increases the odds of success.
Right. And then there's not that much medication for the woman as well, and not a
Right.
surgical procedure or
That's
any
right.
type of procedure for them. So IUI really just for people who don't know what that is maybe you can just give a brief
Yeah.
description.
So IUI stands for intrauterine insemination. So into the uterus, we put sperm, is essentially what that means. So what we do is we spin the husband's sperm down. We get the best of the best sperm. And with a tiny little catheter, we put it right into the uterus and deposit all the sperm. So the way it works is that when you have intercourse, you drop off sperm in the vagina, only 1% or so can swim through and swim in. So only 1% or so make it. Very few make it. With IUI, 100% of the sperm we can drop off. So then more sperm means more normal shaped sperm as well.
Right. And you're spinning it, so you're making sure you get the best of the
Best
best.
of the best.
The best of the
The
best.
forward
Okay.
swimmers. It's really cool. Yeah.
No, that's wonderful. Well, thank you. Is there any other treatments or tests or procedures people have to go through that they should know about? Or this is basically the fit.
Well, I think beyond all of what we kind of talked about now, there are some things that guys might need. For example, if there is a vasectomy involved and they don't want to reverse it, well, they can undergo something called TESE or TESE or testicular sperm extraction. I know this sounds scary, but what it is taking a little needle and literally sticking into the testicle and sucking out the sperm and using that for in vitro fertilization.
Oh, okay.
Yeah.
That's great to know. Oh,
I know
good.
it's scary.
Yeah, I know. I think I could see a lot of men cringing right
Yes,
now.
yes, right.
Yeah, and a lot of women maybe not.
Right, right. They're like, well, he deserves it. No, 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 no. It's really
Yeah.
nice. Yeah.
Yeah. So really what I'm hearing is male infertility, there's one basic test that people go
Yeah.
for, and that really leads everybody in the same direction.
Yeah.
And there's really not too many surgical procedures at all. I mean, it doesn't sound like this last one people are going to be going for too
Right.
much.
Not too often.
And from the tiny bit of experience I've had in the scheme of the world, right? I find that male factor infertility is one that is not it, it's not as complicated and people conceive.
Yeah, absolutely. You know, luckily with the advent of a lot of these technologies like the sperm extraction or even something called ICSI, which stands for intracytoplasmic sperm injection, which is just to inject the sperm into the egg so the sperm can't get in on its own, will help it. So with the advent of some technologies, we really can overcome a lot of male infertility.
Right. So you could create the embryo in the lab and then have it transferred.
Yeah.
So yeah.
Yeah, it's lots
Well, thank you. This is a great overview.
Thank you.
I mean, it's really fabulous. I think it's important information for people to realize, especially when they're first going in and they're trying to conceive. They need to know that. So thank you again.
My pleasure.
It's
Thank
always
you
such
for
a pleasure
inviting
to
me.
have you here. Oh my God, and to see you in person. Thank
Awesome.
you.
Thank you.
Okay, well, if anybody has any questions, they want to contact Dr. Ku, if you're in his location, how would they get a hold of you?
You can find me on my social media. I am Dr. Knocked Up online. I'm Dr. Knocked Up. So you can find me in any
I love that name.
sort of social media outlet. So that's great.
And if they want to go see you in your office?
Yeah. So we're at Dallas IVF. You can find us at dallasivf.com. And I'm at the Frisco location. We have 4 other locations and 5 total. So happy to help out in any way I can.
Okay, great. And if anybody has any questions or comments, please feel free to reach out to me at lorimetz.net. Okay.
Awesome.
I got to put my glasses on for this book.
Oh, yeah, no worries. I brought my readers as well.
Oh my goodness. Okay.